Alright, folks, let's bite into the sugar mystery. Since childhood, we've all been told don't eat candies, otherwise, you're gonna get cavities. But here's the truth. The truth. Sugar isn't the real villain in this cavity caper. Hold on. Before you start throwing your toothbrushes at me, hear me out. Sugar does not drill holes directly into your teeth. It's just a getaway driver for the real culprits. The real villains? These bacteria. These microscopic monsters in your mouth love sugar more than a kid loves Halloween. When you eat something sugary, these bacteria throw a party in your mouth. And like any good party, there's always a mess left behind. As these bacteria feast on sugar, they produce acid. And this acid is what actually attacks your tooth enamel. It's like the bacteria having an all-you-can-eat buffet, and your teeth are the ones paying the bill. Here's how it gets interesting. It's not as simple as this. There are 3 factors that are involved in this formation of cavity. There's pH, saliva, and the time factor. Let's talk about pH first. pH is a scale where you range from 0 to 14. 7 in the middle is neutral. Anything below 7 up to 0 is acidic. Anything above 7 to a range of 14 is called alkaline. Now, in a healthy mouth, a pH is about 6.2 to 7.6. Now, what's important? Studies have shown that there's a critical pH that is important for formation of these cavities, and the pH is 5.5. This is where the cavity formation, or in scientific terms we call it demineralization, happens. Now, when you eat something and these acids are produced, the pH in your mouth falls. If it falls below 7, towards the 5.5 critical pH value, the demineralization or the cavity formation starts happening. Overall, the enamel weakens, and this prolonged attack can cause demineralization. Now, let's go on to the next factor, saliva. This is your Superman, the savior in this. Saliva helps in buffering. What it does is just neutralizes these acids and maintains the pH of 6.2 to 7.6. Now, the time factor. It's not important how much sugar you eat, but it also is important how often do you eat. This is where it gets interesting. Saliva does not get a chance to remineralize, or what we call in simple terms, repair the damaged enamel or the tooth. And hence the time factor at how many times do you eat the sugar becomes a very, very relevant subject here. I know a lot of you out there are thinking, I'm ambitious, dreamer, achiever, hustler, go-getter, chasing my dream right now. I don't have enough time for these cavities. But let me throw some light on why is it important to take care of your teeth and prevent these cavities. Number 1, pain. A lot of people have mentioned that the pain caused by these cavities is worse than headache, sometimes earache. It's gone to an extent that a lot of people have mentioned it's comparable to labor pain experienced in women. Overall health. Good dental health is known for good overall health. Dental health has been linked with heart conditions, diabetes complications, as well as respiratory disorders. Your smile is your brand. In today's world of social media, where Insta, dopamine gram, or scrolling through your Twitter, becomes a fan favorite, your smile is your brand. It affects your confidence. If you have cavity, it's going to affect your overall brand. So take care of it now. And lastly, financial wisdom. It is cheaper to prevent cavities than to fix it. You don't agree with me? Go ask your parents, grandparents, how important is it to take care of health now than later? Start respecting your body, including your teeth, now, and it'll respect you when you get older. Trust me, they have the wisdom on their side, even though they might not know the difference between TikTok and a clock. Here is the cavity breaking news. Sugar aren't the real culprits behind the cavity formation in the mouth. It's the bacterias. The bacteria that eat the sugar, that produces acid, that alters the pH, does not allow the saliva, our saviors, to do its job, and the amount of sugar that you have and how long do you have, that affects and forms the cavity. For those of you who are thinking, sugar-free options, guys, you're not off the hook. The real heroes in our story are your dental brush, your dental floss, and your dentist. They are like the cleaning crew that helps clean up after the sugar bash. Make sure you keep them on the speed dial, and remember, think twice before opening the can of sodas. So there you have it, folks. The truth about sugar and cavity. Next time someone tells you sugar causes cavity, well, tell them about this. Watch their mind get blown away. And remember to smile. Wait, make sure you don't have spinach stuck between your teeth. This has been Truth to be Told. Don't forget to leave your cavity fighting tips in the comment section below. And subscribe our channel because that motivates me to keep doing these videos and bring out these information in a fun and nice way to you guys. Again, this is Dr. Akshay Parmar signing off. And cheers. Keep drinking healthy.